This is the Video President's Report for January-February 2013. On January 31st, the Centers for Medicare and Medicaid Services announced Grace and Valdez Hospital's participation in the Bundled Payments for Care Improvement Initiative. Under the initiative, organizations enter into payment arrangements that include financial and performance accountability for episodes of care. These models may lead to higher quality, more coordinated care at a lower cost to Medicare. Grace and Valdez are participating in Phase 1, Model 2 of the Bundled Payments Initiative. The episode of care in Model 2 includes the inpatient stay in the acute care hospital and all related services during the episode. The episode will end 30, 60, or 90 days after hospital discharge. Participants can select up to 48 different clinical condition episodes. Phase 1 runs from January through July of this year. Phase 1 participants are generally expected to become participants in Phase 2, where approved participants opt to take on financial risk for episodes of care, starting in July 2013. Grace and Valdez Hospitals, along with Duke University Hospital in Durham and First Health Moore Regional Hospital in Pinehurst, are the only 4 hospitals in North Carolina taking part in Phase 1, Model 2 of the Bundled Payments Initiative. Construction plans for the new Numerian Healthplex have been filed with the City of Marion, a step required for license approval. At the site itself on Sugar Hill Road, site preparation is underway. Existing structures have been removed and grading has begun on the property. When the 22,000 square foot building opens in October, it will house all 3 Blue Ridge Medical Group practices in Marion, an urgent care center, imaging technology, and pharmacy, among other services. Blue Ridge HealthCare lifted its visitation restrictions on February 12th due to a significant drop in the number of patients being seen with flu-like symptoms. Despite the drop in flu cases, the organization recommends that visitors not enter the hospital if they are experiencing flu-like symptoms. To reduce the chances of getting or spreading the flu or other illnesses common during the winter months, Blue Ridge's infection prevention staff recommends coughing or sneezing into elbows or tissues, staying current on vaccinations, frequent hand washing with soap or an alcohol-based hand sanitizer, and avoid touching eyes, nose, or mouth with hands. For the 8th consecutive year, Blue Ridge HealthCare will sponsor its annual Lady Fair on March 23rd. The region's largest event dedicated solely to women, Lady Fair will again offer a variety of free health screenings and more than 60 businesses and organizations providing products, services, and worthwhile causes involving women. The event will be held at the Higher Education Center across from Grace Hospital in Morganton. Blue Ridge HealthCare's presence on Facebook has reached a new milestone at the top of hospitals in both North and South Carolina.
We started our Facebook campaign back in the fall with around 500 friends. We systematically worked on a lot of different tactics to bolster our presence. We now have around 9,000 likes on Facebook, and this puts us really at the highest level among hospitals within North and South Carolina. We have very strong interaction with our post, a lot of forwarding, a lot of liking, and a lot of tagging. Having almost 9,000 likes means we have a reach of up to 100,000 people on a daily basis, and a extended reach of well over a million people, almost 2 million people in fact. It's really priceless, the interaction you can have with people, taking your information and forwarding it on to their friends, their family members, and letting them know about services and events going on around Blue Ridge HealthCare. So it's an exciting way to communicate with people.
In 2012, lean transformation had a $1.2 million impact on savings at Blue Ridge HealthCare facilities. Lean Transformation Director Jane Phillips tells us how these savings were realized.
Each month we pull together a different multidisciplinary team to focus on a specific problem area and then collaborate to simplify patient flow or workflow in that area. In addition to these monthly rapid improvement events, we've trained over 100 staff at Blue Ridge to use lean tools and take a scientific approach to problem solving. Through these efforts, we're committed to improve the patient experience and keep healthcare costs low in the community.
That's all for now. Thanks for watching the Video President's Report.